Scott's asked me to come here and talk about healthcare in the next 10 years and what it's going to look like. And it's actually an opportunity for me to urge a bit of a call to action to the audience around some of the challenges that are going to face the sector over the next 10 years. And really moving from scarcity to abundance. And I'll talk about that in a minute. So Vensa today, we're in the business of connecting the community with primary care health services. So if you got any health reminder from your GP, you know, we work with about 70% of general practice across the country and impact about 3 million New Zealanders nationwide. And it's really about timely access to primary care services, whether it's a child getting an immunization on time or helping a smoker to quit smoking early. It's the sort of thing that we really, really love. Like, as a company, we're obsessed with general practice, and I would have loved to have more GPs here. Because general practice, we believe, is the change agent that can make all the difference for healthcare over the next 10 years. If we look at health spending, over the next 10 years, it's going to increase from 6.8 to about 7.7%. By 2050, it is expected to rise to about 11%, effectively adding to the debt of the country. And the current model has been great in you know, our ED admissions, you know, are on the decline for triages 4 and 5. But as you can see from this chart, it's growing faster than GDP, and it's not sustainable. I took a cab in, and I always love to ask the cabbies about their experience with general practice. And you know, the cab driver was saying to me, you know, I have to take time from my cab and go and see a doctor. And typically, they'd have to wait about an hour in the waiting room before they can see a doctor. And for them to get an appointment on the same day, it was a no-go. He struggled. So in this country, 27% of the population have an unmet need when it comes to accessing primary care. That is attributed to coordination, poor coordination in general practice. It is also attributed to cost. An additional 3% is attributed to transport. Workforce issues been in a bit of the media lately, so 50% of doctors are on par to retire over the next 10 years. And nursing workforce is on par to retire the following decade. So by 2035, you know, we will effectively have half the workforce. And from a hospital perspective, ED admissions in the last year, we had just under 200,000 admissions that could have been triaged in primary care. The good news is those triages are reducing at a compounding rate of 1% year on year at the hospital. So the primary care strategy is obviously responding to the demand. So what does this mean? Well, if we don't change in 10 years, and I've got kids now and I've got a growing family, if nothing changes and we transport ourselves to 2027, to, you know, if your kids are sick or, you know, if your mother is sick, to take them to the, you know, to take them and go and see a doctor, you know, you're going to be dealing with a very long wait time. And the idea of taking my kids to ED to avoid long waiting times in 10 years is a very scary proposition, and I don't think any of us want that for any of our family or whānau or friends. So we almost have to change out of necessity, and I think that's where technology, business model change, offers that opportunity. And today, for the first time, I'm going to share with you the our 10-year plan on how we plan to tackle this horrific problem that the country is about to face, and invite all of you to collaborate and join in the journey. So if we think about the next 10 years, we imagine a primary care system that is human-centered and convenient. So whenever any of us get sick, there's this kind of debate that goes into all of our heads. Do we take time off work? Do I stay in bed? Do I Google? Do I go and see it? Do I actually go and make the effort and go see the doctor, or do I wait it out? So we want to make primary care convenient so that people will immediately make the connection in their brain that actually I can access care right now, and that's kind of the first theme that we want to address in the next 10 years. Increase efficiency in general practice. So only 60% of the doctor's time is actually spent on clinical work. 40% of work is spent on administration. It's spent on resentment. It's spent on, God knows, running the business, and they burn out. Up to 50% of nurses' time is spent on non-clinical work today in general practice, and that includes, yes, still, licking stamps and sending letters for recalling patients that need to be seen that have not been seen. And I was talking to a CEO of a PHO yesterday, and he was saying that he estimates that 30% of his practice teams are actually burnt out right now at any given time. So what can we do to take away the non-value intuitive work out of general practice and get them to focus on the stuff that they're really good at? Deliver care in a different way is another important theme. So it's essentially reimagining the bricks and mortar model of primary care and looking at what can different people within the practice team upskill to do different kinds of work. And I'll talk about that in a minute. And the last piece is embrace a disruptive digital transformation. If they don't do that, we heard Dave talk about 25% of people Google, and they are okay with the response that they get because that's kind of convenient and they can kind of get on with their day. So it's about getting general practice to embrace a new disruptive digital value network that enables them to tap into that convenient method of engagement. So those are the sort of the themes that we as a company are imagining in terms of an experience and how people will engage with general practice in the next 10 years. So last November, we launched the Vensa.com platform. It's a platform that's designed to connect the community with health providers. And today, we've basically got the text-to-remind system, and we've got the online appointment system. It's a free system. It's free to all general practice. And you can book an appointment in under 25 seconds through that. And some of the work that we're starting to see emerge out of it, going back to that nurse that is looking stamp envelopes and delivering them in the mail, here's an example of the flu vaccine recall, completely automated and outsourced to software, and actually offering a really convenient service for patients to book in their flu jab. So essentially mapping out all the primary care services offered in general practice online so people can engage with them and access them at the time that is convenient for them. And also, you know, you might go in, you know, for a specific service like a skin check, and you know, only the doctors that would offer that service would be the people that you can actually book the appointment with. So that kind of coordination piece gets solved as well. So as a company, we believe the path to digital transformation is an evolutionary process, not a revolutionary, sorry, excuse my French, not a revolutionary. So we're taking a stepped approach, and we've got a plan that, you know, we will see that the next step for us is to introduce cashless repeat script process. So most of general practice debt is attributed towards people accumulating, you know, repeat scripts by calling in, and they accumulate debt, you know, on their account. So streamlining that process to ensure that people can access their repeat scripts, you know, through a cashless experience. And you know, we're talking to the ministry to integrate into the national EPS service as well. V-campaign, so the work that nurses do at the moment, essentially semi-automated to enable anyone to do their recalls in the medical center. I guess the kind of sort of as we move with time, you know, within 6 months, we want to also enable cashless health access when it comes to going and seeing your GP. So essentially walking in and walking out of the medical center, kind of like how you would with an Uber. And in the background, you know, generate all of the invoices, reconcile all the invoices for the practice, and for the patient, offer services like ETAs, post-discharge summary notes, which doesn't exist from a health literacy standpoint. That doesn't exist in primary care. And I guess the game changer for us is to get the practice teams to then sort of evolve into a new value network of online, you know, cashless online consultations. And I'll talk about the value of that in terms of a 15-minute consult. In 15 minutes, you can do one consult. In an online consultations, you can do up to 3. And that's what's needed to sort of get primary care to step up its game, that there needs to be a clinical value and there needs to be a business value, you know, for practices to actually embrace the change. And lastly, we want to open it up for third-party developers to innovate and create their own applications. We partnered last year with Hierarchy PHO, who are here to develop a weight management app with the collaboration of the ministry. So this is something that, you know, we might see on the platform at some point, where a nurse can actually prescribe a weight management app to, you know, people who are with type 2 diabetes. Or you know, pre-diabetic, which some clinicians disagree with the term, but we're not going to get into that. So if I think about the disruption, if you think about sort of disrupting in a positive way rather than in a negative way, we kind of want to work within the general practice team and get them to move up. So the customers will do what the reception team does at the moment. So booking an appointment, payments, walking in and out of the practice, that gets outsourced to smart software and the patient, and actually in the process offers a convenient service for the patient. The front desk will do some of the work that the nurses do inside the medical center around administration and around pre-call and recall campaigns around general practice services. The nurses will become nurse practitioners and will probably take on, a good dozen or more of the, the work that the GP does, and get in a position where they can actually prescribe for certain infectious disease, and get the GPs to do what specialists do. And the only way we can go up that value network and disrupt the hospitals is by offering each person in that circle the right tools. And we think that we're going to get there in 4 years. So I told you that we love general practice, and it's about keeping people out of the hospital. We're also creating a new service called Vensa.com Social Health, designed to connect people of similar background, similar ethnicity, similar lifestyle, similar conditions with each other, to share stories around how they have managed their chronic conditions, and how they have dealt with their conditions, and kind of have it so that it's peer-to-peer rather than relying on the health system purely to manage people with chronic conditions. And through that, we are going to partner with content providers, because we realize the dangers of Google and the randomness of people looking at all sorts of random content. So we've partnered with Health Navigator as an example, where all their content will be made available to the users of that service. Interoperability. In the interest of time, I might skip that. Essentially, if you look to your left, you'll see a traditional GP clinic, brick and mortar, two doctors that own it. They employ some doctors, they employ some nurses in the front desk team. We're essentially trying to move the needle so that the clinic becomes an exponential clinic. So a smaller team, and that's going to happen because all of them are going to retire anyway. And so a smaller team, and a lot of the functions outsourced to AI and computers and microservices. And you see that bubble with the social network, so a facilitated social health network where doctors have an oversight of the connections between different people that they serve in their patient enrollment. And then outside, you see doctors in that new disruptive virtual value network. So I can go and set up a GP clinic and contract on my staff. So what can a GP clinic do to outsource and contract other GPs around the country, and that's what virtualization will enable. All right, so that's pretty much me, and I think my kind of last call to action is, it's not about technology. It's about education, and my kind of call to everybody in the audience is to kind of come on board with us to educate the primary system to deliver care in a different way. Thank you.